evening and welcome to another informative episode of Health Check, right here on Hope TV where you look and live. My name is Kerry Kagiri. Today we talk about a very interesting part of our body that helps us fight a lot of infections by everything we put inside our mouths, everything that goes into our ears and great parts of the throat, the nose, and the ears. It's the ENT area. We're talking about infections of the adenoids, tonsils, and sinuses. And with me in studio to talk about this are two great specialists. I want to start with one of our resident pediatricians. Karibu sana, Dr. John.
You're welcome.
Thank you so much. You can just talk about a little bit where you practice and what you do.
I spend most of my time around Mpisha in the children's center, and that's why I see children from the age of 0 up to the time when they transit to become adults.
Yes. And what age is that?
Depends on who we are seeing, roughly from 0 up to about 18 years.
Okay, that's really good. And joining us for the very first time is one person who's really special to me. This guy absolutely comes through. He's my friend, personal friend. And his name is Dr. Mbera Gikonyo. Thank you for coming.
Yeah, very happy and very glad to be here.
That's true. Please confirm that we are friends. So
I've known her since she was born. So we are old friends.
Thank you, sir.
Yes.
Even as we talk about that, ENT, what is this practice all about? For someone who is watching machinery, they're like, ENT?
Yeah, ENT is about the ear, the nose, and the throat. Because these areas are connected to each other. So as a medical specialty, we study them as one unit. And we look after those areas as one unit because an infection or illness from one part of the ear or the nose can go to the throat or vice versa.
Wow.
So we treat it as one area.
And that's amazing. The correlation between your practices, you manage the disease, you do the knives as well.
Yeah, we do the surgery where it is necessary to operate on the patient, then that comes to ENT.
You can just mention where you practice in case someone needs to urgently see you.
I've got two offices. One is at Gertrude's Children's Hospital, which is where I see the children. And then for adults, I see them at my office in Landmark Plaza and also at the Nairobi Hospital.
Okay, absolutely great. Let us start by defining these areas. We have tonsils, we have adenoids, and we have sinuses. We can start with you, Dr. Maybe.
Yes, I think broadly that all of those are found in the upper respiratory or upper part of the breathing system. If you imagine the breathing system from the nose all the way to the lungs, then what you have mentioned is what lies between the nose and maybe the windpipe. So I think I'll define. I can define one, then I had over to Dr. Gikonyo as well. So the tonsils are the adenoids. They are soft tissues that contains defense cells. They are found that the tonsils will be in the throat. They are what most people call glands. And then the adenoids are a little higher up in the back of the nose. Okay. So those are the tonsils are the adenoids. They're just soft tissues at the back of the nose and the back of the throat that carries cells that do defense work. The white cells, yeah.
And people say, nasikia niko na sinuses. What do they mean when they say that, Doctor? When they come to you?
Yes, sinuses are a bit of a mystery to many people because people come to us and say they've got sinuses or the one sinus is removed. But there's a misunderstanding as to what sinuses are. Sinuses are actually air spaces below the eyes, between the eyes, behind the eyes, and on top of the eyes. They're actually in the bone of the face. And those air spaces communicate with the nose or are connected to the nose. So they are part of that. So they're actually spaces. They're supposed to have only air and a bit of mucus. But in some people, they have infections. They have bacteria. And when somebody has sinuses, it means those areas are infected.
Wow. Yes. Okay. Even as we talk about that, you diagnose these things. How do you tell when someone has tonsillitis, for instance, someone comes to you?
Okay. By tonsils, many times people mean infections around the throat. And the tonsils are a very specific area of that throat area. So if at the beginning of most infections, whether they are viral or bacterial, there will be some discomfort. So unfortunately for maybe 1 year, 2 years, they have no words for the throat. So all you notice is a baby who is not feeding well. And as they get bigger, maybe by 1 year, maybe between now 2 years and 4 years, when they start talking, they can say anything from any pain in their lips or the mouth or the neck however they imagine where the throat is. But then above 5-6 years, they can clearly say they have a sore throat and above. So that's the pain and the discomfort.
Can you tell by just feeling? I see the guys who feel like they're experts. They touch like this, they say.
Any diagnosis requires the symptoms, the complaint, a good looking at it, and sometimes use of instruments to clearly visualize. Yeah, so that's how one will be able to tell whether the tonsils have a problem. Yes.
Daktari, someone comes to your office and they're feeling like they have something, they don't know what it is, and maybe they're talking about adenoids. How do you diagnose that?
As my colleague has said, the history is very, very important. Like for young children, the mothers often come and say, my child snores at night, or my child, reaches a point in their sleep where they stop breathing and they wake up. We call that sleep apnea. Or my child is unable to feed, or my child cannot close their mouth, or when my child is suckling, they have to keep on taking a break because their nose is blocked all the time. So in such a case, then we will suspect something is wrong with the nose. Then we look at it. We might find mucus in the nose. We might find a discharge in the nose. And normally adenoids cannot be seen from the outside because they are behind the nose and above what we call the soft palate in the mouth. So then we normally do an X-ray to try and see if the adenoid is indeed swollen or not. And then for the tonsils, as my colleague has said, when we look with a headlight or with a torch, we can actually be able to see them. And sometimes you can see a tonsil that is massively swollen. We can see a tonsil that has got pus on it, what we call exudates. You can see they almost look like white waterfalls on various holes. Sometimes you can see one tonsil which is very, very large, meaning it has got pus in it or an abscess. So just by looking, we're already able to actually see quite a bit of the challenges which may be there in that particular area.
Okay. As you talk about that, you talked about snoring, and I'm sure there are many couples that are watching. Is there any help? I've seen there's a pin you can buy. What's the help for couples? Let's be frank.
Okay, when it comes to snoring can be a big problem. Of course, in children, it's easy to manage because often it's the adenoids, and it can be the tonsils, and those can be managed. But normally there are certain criteria, like for removal of tonsils, the child has to get the tonsils more than 6 times a year. Or they have to have other complications, like what we call, maybe they get fevers and then they get convulsions. Because removing a tonsil is an operation. So it's only undertaken when there is no other way. So the pediatricians normally manage it through medications. But if that fails, then we consider removing them, if the patient meets the actual criteria. But for adults, the problem of snoring is completely different. Because often it's not caused by any adenoids. Adults normally don't have adenoids. But some of them have what we call, enlarged turbinates. Turbinates are like shelves in the nose. Everybody's nose has got 3 shelves. And in many people, the lower shelf is enlarged, especially if they have what we call allergic rhinitis, meaning they have allergies around their nose. So over the years, those turbinates become very, very enlarged. Some people also have what we call polyps or growths within the nose, which also block their nose, and that can contribute to that kind of situation. So normally you have to examine them, do some tests or investigations, and then once you find the cause, then there are many, many treatments. Some it can be a medical treatment, some it can be a weight loss program, others it can require an operation. And for many it works. There are couples, when they go on holiday, they take different rooms.
Because it's a crisis.
So much.
It is.
It's like a generator. So the other person cannot sleep.
I know. Absolutely. Great conversation, to be honest. Sinuses for children. What happens? How do we diagnose this?
So as Dr. Gekonyo said, those 3 areas are interconnected.
All of them.
The ear, the nose, and the throat. And therefore, when somebody has got a problem with the sinuses, then the symptoms would be the pains around the eyes, or the nose blockage, and or some colored discharge from the nose. So those might be the early symptoms. If it goes on, then the pain would be more of a headache, and the headache would be now have description. They may even have fever. They may even look dull and sick.
Because all these are interconnected, what are the causes? What can cause one to feel this way? Or if there are particular causes for different ones, you can go ahead and highlight. I can start with you, Dr. Gekonyo.
There are various causes in children and even adults. Most of the time, they are viruses, viral infections. And these are often picked up in the same way you find now COVID is picked up. People next to you cough or they sneeze, and therefore the viruses which cause these infections move from one person to the other. Many parents of young children often complain that when schools open, many of the children fall sick. Yeah, and even some children, the first time they go to school, they have huge challenges. Almost every week or every other week, they are sick. They're running nose, with throat infections, with a cough, because they are going and meeting new children who have new bacteria and new viruses they've not come across. So as their body builds immunity, it ends up having to fight all these infections.
Yeah.
But in most cases, they have viral infections and then also bacterial infections, which they pick up from other people in the community.
Okay.
Like right now, many people are very healthy, mainly because they're not going out, they're washing their hands, the children are at home, and so you find they are healthier.
Okay. We'll be right back. We have to go to a break, but we want to welcome all your questions, comments, compliments. You can go ahead and send them on 22232, which is our text line. And at the top of the hour, we'll be opening up our call line. So prepare those questions. I have paid for you free consultation from both the doctors. So go ahead and call in when we do that. 22232. This is Health Check on Hope TV, where you look and live. We'll be right back.
Tangu mwishoni mwa mwaka jana, homa ya virusi vya corona yaani COVID-19 imeibuka kuwa tisho kubwa la kiafya. Maambukizi ya homa hii yameenea ulimwenguni kote, wala hakuna aliye salama. Serikali kupitia idara ya afya imeweka mikakati, miongoni mwao ikiwa uchunguzi wa homa ya corona miongoni mwa wasafiri katika mipaka yake yote kote nchini.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
Inatisha kufikiri kukohoa tu kidogo kwa mazingira haya unaweza sababisha mlipuko wa homa hii usio na kifani. Ili kuzuia haya, serikali imeweka mikakati tosha kuhakikisha usalama wa Kenya wote.
The facility has all the equipments you need from handling a basic patient up to ICU setting.
Hata hivyo, wewe pia unalo jukumu katika kusaidia kuzuia kuenea kwa maambukizi.
Citizen responsibility is the key to the success of this initiative and these measures. Let's all do what we have to do individually. And this is how we are going to defeat this disease.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
Always ensure that nimefanya proper sanitation ya mikono. Every time na board matatu, lazima ni sanitize mikono.
Sisi kama taifa tumepata kukumbana na changamoto nyingi na kali maishani, na kila wakati tumeibuka washindi. Hii homa ya COVID-19 hata kama inatisha, si tofauti nazo. Komesha corona, zingatia maagizo kutoka Wizara ya Afya, nawa mikono jinsi inavyostahili.
I will stand up before the congregation and testify of the wonderful things you have done.
I was on my knees, and that day, that is one thing that amazed me. For sure, God never lies.
Thank God, because it's only God's blessings that addeth no sorrow.
Mimi naogopa dhambi.
On Testify, we bring to you real encounters with Christ, breathtaking experiences, and life-transforming testimonies.
We testify. Nikamwambia Mungu, kumbuka nimekuwa katika njia zako. Kama kuna wakati wa kuniokoa ni huu.
Ni heri ni uwawe, nizikwe na hawa hatujazaliwa na wao.
Oh, najua Waluya.
My husband did everything for me. For 4 years, I used to cry and pray to God because
Faulu ukiwa na Mungu.
Join me this and every Thursday at 8 p.m. on the program where our faith in Christ keeps growing, right here at Hope TV, where you look and live.
Life is not the same again. We testify. We celebrate. We celebrate for all you.
back. Today's conversation on Health Check, right here on Hope TV, where you look and live. We're talking about adenoids, we're talking about tonsils, and we're talking about sinuses. And to do that, our experts, as always, we are blessed, we are privileged to have two great men. If you just joined us, just meet our doctors. We have a pediatrician in studio, Dr. John Washira.
Yes, please.
Thank you so much. And our ENT specialist. Is it ENT surgeon?
Yeah, ENT surgeon, ENT specialist.
Yes, his name
correct.
is Dr. Mbera Gikonyo. And the conversation we continue with is how our ear, nose, and throat is affected by various things. We just talked about viruses. And currently, we are facing a very serious virus, coronavirus. We cannot ignore that. This is right up your alley. How does the coronavirus affect us with our ear, nose, and throat? And what is the extremity if we expose ourselves to the same?
The coronavirus is a respiratory virus, meaning it comes through the airway. It can come through your nose, it can come through your mouth, and this is why you find people covering themselves with the masks as recommended by the governments all over the world. Apart from that, it can also enter the body through the eyes. So even having glasses or watching out for your eyes is also very, very useful. Once it comes into the nose, it then colonizes or begins to multiply in the mucosa or the layer of the skin inside the nose. And once it does that, it can cause a number of problems. In some patients, it can cause the loss of the sense of smell. Yeah, and in often some people, that is all they have. They cannot smell, and that is a real challenge. And then from there, some also have an altered sense of taste, and that can also create quite a challenge. And then once a virus, when it's in the nose, occasionally it can go towards the brain, and people can have confusion. They can have other brain symptoms. Somebody becomes disoriented. They don't know where they are. They don't know what they are doing. But of course, the worst effects is when it goes down to the chest.
Of course.
Then somebody now cannot breathe, and once they cannot breathe, it becomes a medical emergency. However, the coronavirus is basically a virus which runs for 2 weeks. So from the day you get it up to about the 5th day, you're fairly okay. By the 7th day, you have symptoms. If things get out of control between the 8th and the 10th day, you're in hospital. Yeah, but for many patients, they have no symptoms. They feel perfectly okay. And they recover without any symptoms, often without knowing they even had it.
So when does someone come to you? Because this is something that can be stopped. And I think, Dr. John, you can just encourage the person that's watching. If they feel the symptoms, they shouldn't be afraid of quarantine. They need to step out and get checked while they can, right?
Yes, just as Dr. Konyo said, the other symptoms would be just a common running nose, nose blockage, a cough, a sore throat, a pain, a itchiness. So in the same symptoms that one would get with flus as well. So I think the point is, at the moment, if anyone has signs or in the nose, the throat, or the chest, then they need to present themselves to a health facility and then get checked up.
Okay,
yes.
Let's pick up from we were talking about what causes some of these things. We've talked about children, when they go to school, they get exposed to other bacteria and viruses. What are some of the other causes of either of the three diseases we're talking about?
Yeah, so we said viruses are the commonest. Most people, when they get throat infections, ears, sinuses, they are mainly caused by viruses, but they can also be caused by bacteria. The mode of transmission is the same. It's still through the droplets when people cough, sneeze, and then the one thing is that most people, when they cough, the reflex is just cover their mouth, their nose, their hands. So again, they can also spread in that direction.
Yeah, and that's why this is the plan. It's like you're doing the dab. Don't.
Yes.
Right here.
Yeah.
Okay.
Yeah. So dirty hands or contaminated hands are another way of passing them over. And then now, viruses, bacteria. Rarely you can have parasites like say fungi. Fungi being also a cause, especially for people who may have immunity that is compromised. Yeah, or people who have underlying diseases. They can have some fungal infection, or people who have long-standing illnesses.
Okay.
Yeah. So that is those are the causes. And yeah, Dr. Konyo talked about overcrowding. If you have kids in the school, even in home environment, you realize that when one person in the household has a cough or running nose, they're likely to pass it over to other people, especially when they are viruses. Yeah, so that is those are some of the things that happen. But lower down in the kids, if you have children who have not been breastfed well, the immunity is low, so they're at higher risk of getting these infections. If you have got children who have got poor nutrition, who are malnourished or who have got low levels of minerals and vitamins, they also at higher risk of getting these infections. Even children who have got other underlying problems like say diabetes or asthma or heart problems, they are at higher risk of getting these infections.
Okay. But what happens really? You talked about something like chronic rhinitis, allergies and all these things. Where do these come from? Are they inherited?
Yeah, that's a very, very good question. Right now, all over the world, parents are complaining that their children are developing severe allergies. Even in families where nobody else has running noses, they have no asthma, you find young children are now asthmatic, young children have running noses, and allergies are a big, big problem. Part of the reason is because of environmental degradation and also pollutants in the air. For example, there are very many cars. Now, all these cars produce particulate matter through the exhaust pipe, and this is in the air, and the children breathe it. In the homes where we have, you find that there are all manner of paints, the clothes, different fabrics. Then the things you use at home, the soaps, many homes, each room or each bathroom you go to has a different soap. One is red, one is green. So children react to all these things. You go to their rooms, every room has a carpet. Those carpets sometimes are not washed for long. Children react to those particular things. Sometimes the walls, have water on them from rain or leaking pipes. All those actually contribute to the allergic reactions. And sometimes even keeping the home too clean can also contribute.
A little germ here.
there helps the immune system. So you'll find in the cities, sometimes, in fact, they say that the cleaner the home, the more careful the mother, the more allergic the children.
Wow.
And these are studies they've even done in Europe.
Wow.
So it's not easy for a parent. Sometimes you're being very careful and you end up with a bigger problem than the person who's being careless.
That you're protecting.
Yeah, but allergies are a big problem now, and they manifest in running noses, what you call allergic rhinitis. They also manifest in what you call allergic pharyngitis, and then also in the worst cases, we have what you call hyperactive airway disease. It can affect the nose, it can affect the throat, it can affect the lungs, and then you find people are asthmatic and they have to use inhalers to breathe well.
Just to the causes, I'm reminded, just to highlight for someone who just joined us after the break, what are some of the things that they need to notice in the children and they run to you, or even in the adults? And Dr. Kikonyo will talk about that.
I would just put them in age groups, that if you have a small child who is below 2 years, they can't talk. So they present with a fever, a refusal to feed, looking dull, or sometimes drooling, not wanting to swallow.
Yeah.
When they...
not wanting or not being able to.
Both. They are fearing now because they have
of the pain.
Because of pain,
Okay,
yes.
got it.
Yeah, or even when they put the food there, they don't want to swallow. So that is more to do with the throat, the adenoids, and the sinuses.
Okay.
When they go beyond 2 years, they may be able to point, and they may be able to point at their throat, and they may be having some discomfort there. You may still have the same signs of you may have the same signs I mentioned earlier. They don't want to feed. They have fevers. They are looking dull. Sometimes they may be having a running nose, a cough, an itchiness, a clearing of the throat. Then as they get bigger now, it becomes easier. They can actually point to you where the pain is, and they may be able to say they can even tell you how they are feeling. Yeah, and that goes away now into adulthood.
Okay.
And we mentioned for the sinuses, they may also have pains around the face, the eyes, and the head.
Okay.
The head.
That's
in addition to the nose blockage.
Okay. Dr. Kikonyo, can adenoiditis cause any other conditions?
Yes, apart from the primary problem of the adenoids being enlarged, they can, by enlargement, create many other problems. One of the problems they create is in the ears. They actually block the ears from the inside.
Wow.
There's a tube which runs from the back of the nose to the ears called the eustachian tube. So that tube gets blocked, which is supposed to take air to the middle ear. Then you end up with water in that tube and water in the middle ear. Then you find a child who used to talk is no longer being able to talk because they are losing out. You find you call a child and they can't answer you because they cannot hear you. If it's school, their grades begin to go down. Yeah, but the parents will say, this child doesn't listen anymore. Sometimes they even get into trouble with the teachers, because the teachers sometimes in places they can even be beaten. They're not listening.
Yeah.
But they're actually not hearing from, that complication of adenoids. But the complication we fear the most with adenoids is that because the child struggles to breathe at night, they snore, they're struggling to pull air in and to push air out, they end up with high blood pressure in the chest.
Wow.
And we call this pulmonary hypertension. And this is an extremely dangerous situation because eventually when the heart is beating, it comes across resistant in the chest. So eventually the heart begins to fail. The heart becomes enlarged. So they end up with something we call cor pulmonale. And this can be dangerous. It can even cause the death of a child or can cripple them for the rest of their lives.
Wow.
Yeah, so normally we tell parents that if you find the child cannot breathe, you have to go to your pediatrician. They have to look, they have to debate that matter. Then if you give medication and it's not working and you've been treated a number of times, then you have to, they normally refer you to an ENT doctor who will then take x-rays. And then if it's found you have sleep apnea and the child in a night can wake up to 3 times unable to breathe, then at that point it is worthwhile removing the adenoids to prevent those complications.
Yeah, but as we spoke about it, this kind of fade by 14, no adenoids.
Generally adenoids, begin to grow. In a few children, they can be there even at birth, but they generally, grow and become enlarged up to about the age of 6 is when, for many children, they stop growing. And then from there, they become smaller and smaller, involute, and actually disappear. In adults, normally they're not there, unless an adult gets another disease, say like a cancer from the back of the nose, then that can grow, almost look like an adenoid or a lymphoma. Yeah, but normally in adults or even children above, 9, 10, 12, it's not an issue.
Daktari, how do you treat chronic tonsillitis? There are people who they come, and when does it become chronic?
Maybe you can just start with general treatment before you get the chronic ones.
Sure.
The simple, when they just come over with infection of the tonsils or the sinuses or the adenoids or even the ears, then what we do is most doctors will just look and assess and see what is likely cause of this infection. Majority of them are viral infections, so you do symptomatic treatment. You would give a painkiller or something to decongest the nose or something to help them breathe, if it is a nasal spray or nasal drops, or sometimes where applicable, if they have allergies, some anti-allergy medicine. So that is what happens. Of course, people have got their home remedies like the menthos, which they would also inhale, and sometimes they would help among other things. So that is the commonest way of managing it. Few times they may be caused by bacteria, and therefore they need an antibiotic. So most doctors will choose depending on many factors that they'll be considering. And then if they think they are complicated, maybe somebody is getting recurrence of the infection, or somebody is getting, or there is a severe infection, then they may need to be admitted, and then they may need to get some more investigations and some more treatment. If they are getting more of the recurrence or again the severe form that we talked about, then we have ENT specialists. Then we'll work hand in hand with them. We refer to them. They'll assess and see what mode of treatment would be most suitable. Many times it will just be medical treatment, but then there are criteria that are used to see will they benefit from surgery, and then some of them will end up requiring surgery.
You mentioned Mentos. Let's go into that. Eucalyptus, in hot water, so therapeutic.
I think anything that can soothe the breathing system would be able to help someone breathe because of the dryness, the discomfort that is there, and people have their own home remedies that they do use because we want to help people reduce running to the chemist to pick an antibiotic. We say when it's not severe, then they should just use maybe steam or mentho, or Dr. Ikonyo can add.
Sure. And also just go ahead and explain to us what is severe and what is not.
Yeah. Okay, now generally the way we look at it, especially what you call chronic recurrent. Chronic means it's long term. Recurrent means it keeps coming. For example, a mother comes to the hospital and says that my child has been having tonsil infections for the last 3 years. And then, they tell you that, last year I used to go to the hospital every other month. This time you're going to the hospital every month. Sometimes they even come to hospital 2 times in a month.
Wow.
With high fevers, with coughs. Yeah. There's even one child who was 3 years old. They'd come to the hospital 45 times.
In a year?
Those 3 years. Yeah, so you can imagine. So, you could see almost in a month, they would even come sometimes twice in a month. So that's a case of chronic tonsillitis, that no matter what you do, it keeps coming back. So generally, if somebody gets the tonsillar infections requiring antibiotic therapy more than 6 times a year, then we begin to consider removing them. However, we first of all debate with the mother and try other things. If a child is bigger or even an adult, we even try mouth gargles. And then there are some children in whom there are triggers for the tonsils, even adults. If they take something cold from the fridge, like an ice cream,
Yeah.
they'll have it the following day.
Yes.
If they take, sodas, sweet drinks, or some of the fruit juices which have a lot of sugar, again, that also triggers. So we normally advise the parents, look at what is a trigger, try and avoid it.
Yes.
And some are able to avoid it, and some reach, by the time they reach 6 years, 7 years, 8 years, they outgrow the problem. So we normally attempt to see if the child can outgrow the problem. But there are others that they have to be removed. For example, some get fevers, they get convulsions, and that begins to affect their brain, and that can be a big issue. Then there are others whose airway is obstructed, meaning they have difficulties breathing. So in such a case now, again, there we have no choice. Then, of course, we also listen to the parents, and much more the mother. If she comes and says, look, we are tired, we've had it, we don't want these things anymore. That is also a sign that really we have to do something, because they'll not come to hospital and tell you that lightly. It is because they've tried, they've gone to many places, and for this child, the treatments are not working. So in such a case, then we normally book theatre, and we normally instruct parents. For example, the child should not eat 6 hours before the operation. Then they come to hospital the day before or early that day, and then we go to theatre. And the goodness of the tonsillar surgery, we don't cut somebody anywhere on the outside. We just open the mouth and then get them through the mouth. So that means they'll have no scars. Nobody will know they ever had any surgery.
Procedure.
Yeah. So but that's what we look at, and that's how we go about assessing it.
Okay.
Yeah.
Okay, Dr. As you prepare to answer the next question, there are things, according to cultures and rituals, that sometimes you're told to snip off. What's the name of that?
Yeah, it's called the uvula.
The uvula. Why?
Okay, let me. It was traditional in African lives and in many, many communities. The Somalis, the Kisis, the Kikuyus, the Kalenjins, many, almost all the communities in Africa used to love cutting that off. They believe that's what causes chronic cough. And you can understand because in those days you could not remove tonsils or adenoids. So if the child was obstructed, cutting that certainly helped to some extent in terms of opening up the airway if the tonsils were enlarged. However, modern research has shown that there is totally, completely no benefit at all of removing the uvula.
Okay.
Yeah, so because if the tonsils are the issue, tonsils can be removed. If it's adenoids, they can be removed. So at the moment, we decline to remove them.
Okay.
Yeah, unless there's some very good reason.
Dr. John, what causes uvulitis?
Uvula is that soft part of the palate, of the roof of the mouth, that hangs behind there, and people call that creamy, and that is so it can get infected as part of the throat infection or an infection in the mouth. Yes.
Even with that, when the tonsils are removed, because we know these are important parts, they protect the children, what then takes over that role?
Thank you. I think we started off by saying that tonsils and adenoids are soft tissues that contains defense cells. There are many other soft tissues in the neck region and the head region that have defense cells. So those are just a small fraction. Even when you remove that, you have many more that will take over.
So you're still safe.
You're still safe.
Absolutely. We're ready for your questions, your comments, your compliments on 22232. We want to start answering those questions, and you can go ahead as well and call us live in studio. Free consultation right here, all sorted. Sinusitis, is it preventable?
We said the commonest cause of this infection is viruses, bacteria, and sometimes fungal, and there are many ways of preventing them. You could just look at the general way is build up the immunity. For the children, let them breastfeed early, up to the age of 6 months, without anything else. That way they'll get enough immunity from their mothers. When they start feeding, let them get balanced diet, a lot of different nutrients. That way the body is strong enough.
Absolutely.
As they go out, avoid overcrowding. Right now, as we mentioned earlier, many children have no problem with their throats or their ears or
because
their
they're just at home.
Because they're just at home. There is no overcrowding. So minimize overcrowding. When anybody has that severe cough, running nose, or any other sinuses, then keep them away. And teachers are good with that. Tell the kids stay at home, and they'll until when that goes away. So isolate whoever is very sick. Then the other way is, of course, hand washing, because everybody should be washing their hand, like it's happening now, not just for corona, but for any other
for life.
for life, yes. That helps that. And of course, if anybody is going to cough, or sneeze or blow their nose, then they should not use their hands. And they should do it in a way that cannot affect other people. Commonly, people are now using the elbow. Maybe just use disposable tissues.
Okay.
So that way you don't pass over to other people.
Or even to your clothes, because it does last on the clothes.
Yes,
as well
exactly,
for some time.
Yeah.
Absolutely. Can we now pick up some questions from our viewers? Thank you so much for sending in your questions to 22232. We'll also be coming in for your text. Remember, we are live on Facebook. So what you do is, if you're watching us on Facebook, just click that share button or start a watch party. Let's get everybody informed, even as we fight coronavirus. Okay, fine. We already have a call. Let's start with Moses from Embakasi, and then we come to this text line. Moses, good evening.
Good evening.
How are you?
I'm very fine.
Thank you for watching. What is your question?
I'm just happy to see this because today I was seeing a doctor, a specialist about this. My daughter, we are suspecting she has the adenoids. We've not done the scans to be sure that's the problem. But I wanted to find out, is there any other treatment apart from actually removing them?
Yes. Okay, sure.
Yeah.
Let's talk about that. I think we had already mentioned it, but let's just go ahead and repeat that. Thank you, Moses.
Yes.
How old is your daughter? Sorry.
Yeah?
How old is your daughter?
My daughter is 4.5 years.
4.5 years. Great. Let's go
Yes.
for that. I think you had mentioned it, but let's go again.
Yeah, I think we said what is important is a good assessment. Then the doctor who is seeing the daughter should be able to assess and see, is it something mild, is it something that's severe. If the first time was something mild, then they'll use medical treatment to relieve the symptoms, and then wash out and see, is it something that's happening many times. If it's going to happen many times, then refer to the ENT doctor.
Okay.
If it's again something that is severe, also refer to the ENT specialist. So that way, then there will be now the assessment of, do we need surgery or don't we need surgery.
Okay. Someone is asking, when I take sodas, it causes tongue ulcers and is very painful. What happens? Another one is asking, does the 3 cause halitosis? Do the 3 cause halitosis? Either of you take answer.
Okay. Halitosis. Okay. The first one, sodas. He says when he takes sodas, he gets sores in the mouth. So the remedies, he should avoid the sodas. Because it could be anything from allergies to intolerance to just direct irritation or just a trigger for some inflammation.
Okay.
Yes.
Dr. Gikonya, could you answer this one? If any of the 3 build up cause to halitosis?
Yes, indeed. Tonsil infections can cause halitosis. Sinus infections can cause halitosis. And but there are many other causes. Some people have what we call GERD, which is reflux of acid from the stomach, and that can also cause halitosis. Some people also have gum disease or tooth caries. So normally someone with halitosis has to be evaluated by the dentist, by the ENT doctor, so that we actually find what is the cause. And normally if it's the tonsils and they have tonsil stones or they get infected often, removing them can get rid of the halitosis. But if that is not the cause, then removing them will not help.
That's true.
So it's always very important to make sure the real cause is found out and that it's actually managed. And then some people just think they have halitosis. Nobody else can smell what they claim.
That's true. Yeah, it's like a
it's in the
paranoia.
mind. So no matter what you treat them with, it doesn't work.
Can we just talk about this for 1 second? From your opinion, how do you tell someone that they have halitosis? I had one trick. I'm bored. Let's go brush. But I don't think that helps because it's something. What are some of the? How can you politely tell someone?
I think you can always speak the truth with grace.
Okay, for example, I have bad breath.
Okay, you don't have.
No, I don't. I just said, for example, like
you just say, I've just noticed that your breath smells differently.
Okay.
So can we find out why it is different?
Oh, that's nice.
Yeah.
I have observed. Okay, do you agree with the same?
Well, you have to be close to the person to be able to tell them
That's
that.
true.
Yeah, so, but it's always good if you're with a friend to let them know if there's an issue because it will help them. Yeah, as opposed
My
to
director is suggesting, what is your latest mint? Anyway, we're not going to do that. Let's talk about this one who is asking, good evening, my child is 3 years old. She normally rubs her nose frequently at night, but during the day she is normal. What might be the concern and the remedy?
That's a sign of allergy. It's the allergic salute. People who are feeling itchiness in the nose, and if it's happening in the night, then there are some triggers more in the night. Maybe the house dust mite, the coldness, or something else. The dust in the carpet or the bedding.
Yeah.
Allergic to.
Okay, so what's the cause of action?
should get to a good doctor and have a good evaluation. Then they look at what the possible causes and avoid that.
One is asking, good evening, Daktari, what role do the sinuses, adenoids and tonsils play in the body, and does removal affect their role? I think we had answered this, but we can just respond on that.
Yeah, generally the tonsils and the adenoids are part of the body's defense system. The body is always at war with disease. Every day there are bacteria and viruses trying to attack you. There are bacteria in your mouth right now, the bacteria in your skin, the bacteria in your nose. So those systems of the adenoids and the tonsils, they are part of that defense system. They actually get hold of the bacteria, viruses, process them and alert the body. So the body can prepare what you call an immune response. So they are very, very important to that extent. Removing them is not necessarily a huge issue because like for adenoids, when you remove, we don't remove everything. We actually just scrape them off to reduce the size. So there's still tissue there left enough to do its work. And then for the tonsils, as one becomes older, you don't need that immune function so much because most of the immune function is now within the blood, in the white blood cells. So even if you remove them, even without them, the body is still able to defend itself using other lymphoid tissue, which is found all over the body. Yeah. So one can remove them safely and not suffer any immune deficiencies.
Absolutely. One is asking, what is that thing that comes out when you're brushing your mouth that smells so bad, white in color or cream?
These are usually tonsil stones. That's what we call them. They actually are from the tonsils. Some people on their tonsils, they have holes in them where bacteria hide. And sometimes food particles get in there. And then slowly they harden and eventually become like a stone, which can come out. Sometimes white in color, and it does smell badly. For some people, it can be very dramatic. They can have many in a week. Others, it's once a year. Most people never have that problem. So if it becomes too much of a problem for you, you can see your physician, you can see your ENT surgeon, and they can give you mouth gargles or other solutions which may work for you.
Absolutely. Just a reminder, today we're talking about the ear, nose and throat infections, both in adults and in children. But we do have a pediatrician in studio, Dr. John Wachira, and our ENT specialist. His name is Dr. Mbira Gikonyo. As we have that conversation, one is texting in. This is like totally, it's a tangent, but let's just answer them because pediatrician, you're here. One is asking, a child who complains of knee pains every morning could be suffering from what? Kindly advise treatment. Fred Polly.
Depends on the age of the child, because the first thing is check is a knee swollen or not, because there are many things that can cause that. Could be a child who just keeps on falling, and they do all fall, and they can on the same knee, and they can have that pain. Could be a sign of arthritis. Many times for children, the arthritis would be in more than one joint, or sometimes it can be a bad disease. Can even be a growth on a bone that is causing that pain. So the important thing is get a checkup.
Okay. Just follow up, get to the nearest doctor, go see him at MP Shah. Yes, ask for Dr. John Wachira. Just say, Kerry's friend. He'll be ready. Judith Omboa, thank you for letting us know that you're just watching and you're following. Prince Mawira, thank you so much for streaming live. You're in Githurai 45. Salimia Kilamtu. Mwakazi Fred also streaming live from Adams Arcade with no questions. As we continue with this, we've talked about sinusitis and the diagnosis, the preventability of the above. What is that? What can you tell people? Like as they complain, I always hear someone says, "Naskia sinuses, naskia."
I think one is that sinuses; those are medical terms. It's always helpful to any doctor for one to describe accurately and correctly what they are feeling. If someone is feeling pain, then they should talk about the pain and why it is. If they're feeling blocked, then they say they're feeling blocked and which part of the body they're feeling blocked. When you say sinuses, it may mean totally different things to different people. So it is good for people to describe with their own words what they're feeling. Yeah.
And then you'll be able to...
Then that will help, because some people, when they feel a bit of nose blockage, they say they're having sinuses. Some people, when they just don't know what they're feeling in the nose, they say they're feeling sinuses. So it's helpful to say, I'm feeling blocked. Then the doctor will be able to assess and see, is a blockage in the front of the nose or the back of the nose, is it in the throat?
Yes, okay, that's great. Doctor, how do we tell allergies? There are people who find out they're allergic to pollen after years and years, allergic to perfume. Someone walks in and it's so rude, you just start sneezing immediately. A person has joined the room.
Yeah, no, allergies, it's not always easy to tell what somebody is allergic to. I sometimes tell parents, you have to be a bit like a police officer, a detective who is trying to investigate a matter. because you can find your child reacting to something, like the person who called and said their child at night is rubbing their nose. So it can be the beddings, it can be the blankets, it can be the carpet, it can be the room. Maybe they never open that window even in the daytime. So the problem is in the room, but you can't always tell easily what it is. But in general, you try and see what you react to. For example, if you react to strong perfumes, then you know it is those strong smells or perfumes. Or if you eat a particular food, maybe you eat fish and you start scratching, or you eat eggs and you start getting swellings.
Or black pepper.
Yeah, black pepper. you know, so but one should always take an interest to try and see what is wrong. But there are many other cases where the parent and the person cannot tell. So there are allergy tests nowadays. There are blood tests you can actually do for allergies to see what you're allergic to. There are also skin tests that can be done where they prick you on your hand with various allergens, and then they see what you're allergic to, the reaction. And then, because some people's allergies completely compromise their lives. Their eyes are red, their noses are running, their throats are paining, so they can't even function, or have a good day. So those kind of extreme cases, normally it's very important to know what is wrong and then come up with a therapy for addressing that particular challenge.
Absolutely. Our call line is open right now. You can go ahead and make your calls. Any questions you might be having, even in adults, because we have our ENT specialist. He treats both children and adults, and we do have our pediatrician in studio. You can go ahead and call us. Our number is rolling just right below. I think it's here. Yeah. You can go ahead and keep those questions coming. How do we care for our ear, nose, and throat?
How do we care? I think, again, looking at different age groups, the very small babies, their noses get blocked. So it's always good to have them cleaned with some salt water, some warm salt water,
and
some saline.
Mothers helping. I see there are mothers who
do that. Okay, mothers are loving and caring. They can do anything for their baby. That's just one of the good things they do. But they can always try to get something to suck it out if they can, or get an earbud and get that mucus out, because they can block that. So that's for the nose. Then if of course the child has any signs or of nose blockage, running nose or cough, then one should be able to assess, is it interfering with life? Is it interfering with their playing or feeding? Then take them to hospital. If it's not, then let them fight it out.
Okay.
Yes.
The body is equipped.
Yes. Yeah.
Dr. Gikonyo, oh, sorry, did I cut short?
No. I was saying generally it's just to maintain a healthy lifestyle. Have good nutrition.
Okay.
Yeah, have good nutrition, have fresh air, have a lot of fluids, have a lot of fruits, do a lot of other good things that will make the body strong enough to fight diseases.
Absolutely. Dr. Konya, as you prepare to tell us in adults how we can take care of our ENT system, let's pick a call. Maurice in Kikuyu, good evening.
Yes, good evening.
Yes, thank you for calling Health Check. What's your question?
Yeah, my question is, I was diagnosed with something called GERD. What is the relationship with asthma? Because my bouts have been very recurrent.
Doctor, do you have any follow-up question for him?
No, I can try and answer.
Thank you, sir, for calling.
Yeah, that condition, GERD, refers to gastroesophageal reflux disease, meaning that acid from the stomach comes back into the esophagus. That's a gastro for the stomach, or esophageal for the esophagus, reflux because it's coming backward, refluxing backwards, disease. Now, this is also fairly common in everybody. When the food leaves the mouth and gets swallowed, it goes into what we call the esophagus. And there are two sphincters or valves. One is upper one and one is lower one. In some people, those can be a bit loose, and that can result in the acidity and the food coming back up, and that can give somebody a chronic cough. It can give somebody a chronic throat pain. It can even, in some people, induce asthmas and other, respiratory or chest diseases. So if somebody has that illness, it has to be looked at. There are many, many factors which can be investigated. For example, there are some bacteria called Helicobacter pylori, which may be involved in that particular disease. There could be some anatomical disorder, meaning there could be something wrong with the stomach. There could be ulcers in the stomach. So they have to go and have a physician look at the stomach. They do what we call an endoscopy. They see what is going on. And sometimes it may require medication. Sometimes it may require an operation if they have something called a hiatus hernia. So that has to be looked at very carefully so as to be able to actually correct it.
Okay.
For some people, the correction is very easy. It's with what time they eat dinner.
And that would help actually to
exactly.
give it more time to digest.
Exactly.
Okay.
Some people eat dinner very late and then they go to bed immediately, they lie flat. So they ate their dinner earlier, it may be enough to solve it.
Absolutely.
So some issues are easily solvable.
Okay.
I just want to comment slightly on what he said about children.
Can you hold it and you go ahead and comment, but can you just pick a call and just don't lose the thought, tafadhali. Onesmus in Kericho, good evening. Hello? Oh, Kosgei. Kosgei in Eldoret. How are you?
Yes, I'm fine, thank you.
Thank you so much for calling. What's your question, sir?
Okay, can I speak in Kiswahili?
Tafadhali ongea Kiswahili, sisi tunaongea lugha ya taifa, sawa?
Oh, okay. Mimi naitwa Kosgei natoka Eldoret.
Ehe.
Niko kijana wangu ni miaka 6.
Ehe.
Na ako na tonsil zenye imefura ndani. Zenye imefura ndani. Nataka niulize daktari, nimepeleka hospitali on off na haiishi. Haziishi. Yeah.
Do you have any follow-up question?
Swali yangu ni kwa daktari.
Anakuwa na shida gani?
Tonsil zenye
ako na ushungu, anashindwa kumeza, anakohoa, ako na dalili nyingine yote?
Asikii uchungu, lakini zimefura ndani.
Asante sana.
Tutakujibu, asante sana Kosgei.
Haya.
Asante kwa kuwatch.
So bwana Kosgei, kila mtu ako na tonsils, kila mtu ako na hizo soft tissues ziko hapo kwa throat inaitwa tonsils. Na siko size tofauti. Kuna mtu ako na dogo, kuna mtu ako na katikati, kuna mtu ako na zenye ziko kubwa. Kama hazina dalili yote ya ugonjwa, haziumi, hana homa, hashindi kumeza, ashane nazo. Zikae tu.
Okay.
Lakini kama kuna dalili yote, hapo Eldoret kuna hospitali kubwa na kuna ENT wako hapo specialist. Anaweza onekana hapo ya.
Okay, let's go back to your thought right now and also responding to adults.
Yeah, one of the challenges in modern families is that mothers also work. So they leave early for work and they often come late in the evening.
Yes.
And sometimes in hospital we get mothers who come and tell us, oh, my child is snoring very, very badly. And then you ask her from when, she says, I don't know. The maid went away and now I went to sleep with the child and then I discovered the child snores.
Oh, no.
And so you find that, as parents, sometimes we lose connection with the children. So to encourage mothers and even fathers, when the child goes to sleep ahead of you, on your way to your bed, pass by there.
Please.
Look at how they are sleeping. Listen to their breathing. Look at their posture. See whether their mouth is closed, so that you have an idea if a problem is developing.
Okay.
Instead of waiting until when it's very late or there's a crisis to come. So take an interest even when you're busy. Spend a bit of time with the child, and when they sleep, pass by there. Even if it's once a week or twice a week, just monitor them and see how they are.
Absolutely.
Yeah.
That's really brilliant. Even as we plan to do that, you were telling us on how to care for adults as we continue with so many questions right here.
Yeah, for adults, the beauty of an adult is that one lives with their own body and therefore they have a good idea of what is happening to their bodies. One of the challenges we have, especially African men, often don't go for annual medical checkups. And so we try to encourage them, if you find your nose is blocking or you find you have problem swallowing, you should try and go to hospital as early as possible, even for snoring, because people who snore end up with high blood pressure. From high blood pressure, they end up with heart problems. With heart problems, they also end up with kidney problems. So one thing leads to another. We call it a complication. It's like a car. If your car, you don't check on the water, it goes down, it begins to overheat. If you don't correct it, it burns a gasket or destroys the engine. So you want to correct problems when it is still early. So it's very, very important. If you notice a problem, please seek medical advice.
Okay.
If it's something small, you'll be told, don't worry about it. But if it's something else coming up, then you will be corrected early. And this also applies to cancers. There are cancers of the throat, there are cancers of the nose. And if you begin getting a blockage, it's good for it to be examined, because when it is small, it's very easy to take care of.
Absolutely.
When it's big, it's almost impossible.
I'd like both of you to comment on this one. One is asking, what causes a dryness of the throat?
Okay, dryness of the throat, many times it occurs when people have got some infections. When they are maybe coughing, when they have fever, or they have some inflammation from a virus or a bacterial infection. So they may feel a bit dry. If it's a small if it's a child, you'll realize they want to take water many times. Yeah, but let alone maybe, for the adult, I'll let Dr. Konyo comment.
Kindly.
Yeah, one of the challenges is people with nasal blockage. If your nose is blocked all the time and you have to breathe through your mouth, that can cause dryness.
Absolutely.
Of the mouth. Yeah. And then also some people have what we call autoimmune diseases, which can affect the amount of saliva that their body produces. And that can also contribute to that. So again, it's good to go to a doctor. Just get an opinion.
Okay.
Yeah, let him. You don't have to follow everything he says,
Mhm.
but at least you'll have an idea what may be wrong.
Absolutely. There's artificial saliva. Is there? I mean, teardrops. Is there artificial saliva? No.
One can do with water.
Okay. One is asking, I have been removing this phlegm for a long time now after eating and drinking something. Could it be an allergy?
Usually phlegm, is more than an allergy. And, in some cases it could be an allergy, but in other cases it may actually be some kind of chronic infection. And the best thing is for it to be looked at. That phlegm can even be examined in a lab just to see. It could be a chronic, sinusitis.
Yeah.
And then as somebody, drinks or eats something, that phlegm comes from the back of the nose into the throat, and then, they spit it out. So again, the cause will need to be investigated so as to be able to establish exactly what may be causing it.
Absolutely. Keep your questions coming. 22232 is that text line. As we continue, did you talk about care for adults? I feel like
Yeah. So certainly adults, it's number one, they should take their symptoms seriously.
Okay.
Many adults are actually brought to hospital with their wives, because the wife will come and see this girl and listen to me rather than hear me. So they bring the fellow. And they have a hearing problem. And many men, as they grow older, they actually lose high frequencies, meaning they can hear other men talking, but they can't hear their wives. They can't understand what she's saying because they have lost the high frequencies. They also cannot understand the children.
Okay.
So they should take an interest in their health.
Awesome. Mercy in Limuru, good evening. Thank you for calling.
Okay, Mercy.
Yes, thank you for calling, Mercy. What is your question?
No, nasema niko na shida ya throat. Sometimes nikimeza kitu nasikia ni kama inafunga kiasi. Na hiyo shida imenisugua, na sometimes nasikia ni kama inaenda kwa heart. Sasa nilikuwa nataka juzi nimeona nimesikia ni kama kwa mafua. Na kuna uchungu kwa moja ya refu inapugana kidogo na kuna uchungu.
Okay. Daktari, do you have a follow-up question for her? Okay. Asante sana. Acha tukujibu sasa hivi. Thank you so much.
Yeah, so Mercy, pengine niongee kwa Kiswahili. Umetueleza hiyo shida yako ya kwamba unasikia ukimeza, iko shida ya kumeza, na unasikia uchungu ambayo inakuja kwa masikio ya pande ya kushoto, na pia ni kama inaenda kwa kifua. Sasa hiyo mpaka uende kwa daktari hospitali wa kuangalie, kwa sababu inaweza kuweko kitu inamea huko kwa koo ama kwa mapua ambayo inakupatia hizo uchungu ama hizo shida. Daktari ataangalia aone ni shida gani, pia atapiga picha aone kama iko shida, kwa sababu watu wengine waga iko kitu kama ugonjwa inaanza kuwa pande ya mapua, inaanza kwenda kwa masikio, na ikikosa kutengenezwa mapema inaweza leta shida kubwa. Kwa hivyo ni vizuri kuangaliwa, kama ni shida kidogo upatiwe dawa upone. Kama ni jambo lingine kubwa zaidi ya hapo, basi daktari ataweza kukueleza na hiyo itakusaidia. Lakini si vizuri kukaa na shida kama hiyo, kwa sababu mpaka mtu aweze kupumua na mapua na mdomo ili aendelee na maisha yake.
Vizuri. Ben Were on Facebook is asking, a good show and saying very educative. Thank you, sir. Also asking, my son who is about 2 years old has most midnights is woken up by vomiting. It seemed at first like he's getting choked by the food, vomits and goes back to sleep. And in the morning he would vomit the breakfast. Thereafter be normal and very playful.
Thank you, Ben, for your question. Vomiting can be caused by many things. As mentioned earlier, it could be a reflux. Could be just that the sphincters that close the food pipe are not firm enough, and therefore when he lies flat, then the food is passing backwards. That's vomiting. But 2 years, there could be other things that can also cause that. And so the good thing is for Ben to take his 2-year-old to a good doctor, a good hospital, and have a proper checkup.
Okay. Someone is complaining that you're saying good doctor. Are there bad doctors?
No, okay. What by good I mean it is their own subjective feeling, because you see, if you go to one doctor and you feel you are not satisfied, then you go to the other one. Yeah, so it's their own definition of who is a good doctor.
Awesome. That's Jonah Wanjala in Canada. Thank you so much for watching. He's also asking, is there a cure for sleep apnea?
We would say yes to a very large extent, especially for children. Sleep apnea is a dangerous condition. As I mentioned earlier, as I mentioned earlier, it can actually cause heart problems. It can cause lung problems. It can cause high blood pressure, even in adults. So sleep apnea should not be ignored. If you ignore it, eventually you end up with complications of high blood pressure or heart issues. So don't ignore it. In most people, it can actually be solved medically or mechanically or surgically.
One, Fatma is just saying, thank you, doctors, for keeping us posted. Fatma, I see you and your comment on 22232. Thank you for texting in. Gladys Nyanchoka is asking, what causes nose blockage early in the morning, and what is the remedy in children?
Nose blockage in children, many times, if it's recurrent, if it's occurring many days, it's likely to be a sign of allergy.
Okay.
And more so if it's occurring at particular times, early morning or early evening, the middle of the night. There could be that the triggers are around that time. So again, they should guess and take that information to a doctor. Then they can discuss the options.
Yeah.
There may be need for some decongestant to help the nose, to help one breathe well, or do more investigations if there could be some more blockage, say adenoids or big tonsils or anything else that may need treatment.
Okay, as we continue to receive your questions on 22232, and if you just joined us, Karibu, the conversation is on the ENT and mostly tonsils, sinuses, and adenoids. That's a conversation. Let me ask you, as doctors, you've gone through with a lot of patients. What are some of the myths that you want to dispel when someone is having all this, anything that affects the ear, nose, and throat?
Okay, one is that there are people who believe that snoring is normal for them. They believe that it's kawaida, the way they snore, the way their child snores, or the way their child will keep on breathing with an open mouth.
So, ni kama baba yake.
Ni kama baba yake. Because most allergies tend to run in families. So you find that many people, they have seen other people in the same family with the same symptoms. So they should be, even if other people are affected, doesn't mean that it's normal. One should seek treatment for that.
Okay.
Yeah, so that is that. Even the other thing is the itchiness of the eyes, the itchiness of the nose, the throat, the throat clearing. If one finds someone who does that, they should not say that is the way he behaves or that's their normal. That's not their normal.
Okay.
They should seek treatment and get some treatment.
Yeah, Dr. Nkonyo, as you talk about some myths adults have, Lucy is saying our son who is 26 years old has been suffering from white deposits on the tonsils. What is the cause? And I think we had mentioned what this is, but you can go ahead.
Yeah, so generally there are two causes. One of them is infections. Bacterial infections can cause white spots on the tonsils, but with time, in some people, those can become what you call tonsil stones. They're like small whitish stones which sometimes come out. So if they are too much for him, and the medication he's given does not work, if he goes to a doctor, he gets medication, mouth gargles, or even antibiotics, they don't work, then he can consider having the tonsils removed if he is unable to cope with them or they are disruptive to his quality of life. Yeah,
absolutely. What are some of the myths that people have when they approach you?
One of the myths people have is that if your tonsils are removed, you're going to lose your sense of taste. This is very, very prevalent. In fact, every mother, when she's considering that, they always tell us what will happen to their sense of taste. They will never taste again. So we usually tell them that the taste is on the tongue, and removing the tonsils usually does not affect the taste. Yeah, and then another myth they have is that if you remove tonsils or adenoids, the immune system will collapse. The child will be sick all the time. Yeah, and for most of the children that we remove adenoids and tonsils, a child used to come to hospital every month. Sometimes can go for 6 months or a year without coming to hospital.
Okay.
So those are two myths that are very common.
Sponsor Jolie is really enjoying the show. They're saying watching is very helpful. Thank you for letting us know as well. Keep letting us know. Judith Omboa as well. I see you right there. Even as we do this, hello there. I've been having a problem. My throat itches and is accompanied with a dry cough for quite some time now. What could be the problem? And even as you answer that one, another one, can garlic help sore throats and tonsils?
So the itchiness of the throat, the dryness of the throat can just be caused by viral infections or other infections, or can be caused by allergies. If it's an adult and it's happening many times, there could be also a possibility of bad diseases like some growth, going on in those areas.
Okay.
So the solution is have a good checkup.
Have a good checkup. It's very important. Don't stay with these things for long. Simon in Nyeri, good evening. Simon.
Yes.
Thank you for calling Health Check.
How are you?
I'm fine, thank you, sir. What is your question?
Question is, Mimi niko nasikia kujikuna masikio masaa ya jioni.
Yes.
Na wakati mwingine usiku nakuwa na shida ya kupumua. Meaning that wakati mwingine hata ina na mdomo.
Okay, Dr. do you have a follow-up question, Dr. Gikonyo?
No.
It's okay. Okay. Yeah. Asante sana, acha tukujibu. Simon Nyeri, yes.
Masikio, kujikuna masikio ni kusema ya kwamba inaweza kuwa iko na shida. Inaweza kuwa na kitu inaitwa wax ama uchafu kwa masikio.
Yeah.
Na mpaka hiyo uchafu ioshwe, itolewe ili hiyo shida ya kujikuna kila wakati iishe. Na pia daktari akiangalia ataona kama iko shida nyingine yoyote. Na pia wakati ataangalia mambo ya masikio ataweza kuona kama iko jambo lingine kwa mapua ama kwa mdomo ambayo inaweza kuwa fanya hiyo shida kushike mara mingi.
One is having, just you spoke about ears, one is having noise in the ears for 5 years now.
Noise in the ear is very, very common. It's known as tinnitus.
Tinnitus.
Actually, everybody's ear produces noise.
Oh, really?
But when your hearing is good, you actually don't hear the internal ear noise.
Okay.
But if anything damages your hearing and you begin to lose your hearing, then you start hearing that internal noise, which we call tinnitus. Now, noise in the ear has to be investigated. For some people, they just have wax. You remove the wax, it goes away. For some people, they have an infection. You give medication, the problem goes away.
Okay.
Yeah, so they have to be looked at and they have to be treated.
Okay.
Yeah.
Absolutely. Monica in Mombasani.
Yes.
Thank you for calling.
This is Monica from Mombasa.
Yes.
I have been eating beetroot raw.
Beetroot.
Yes. Raw beetroot. For some time. And nowadays, when I try to during night, I always feel a lot of thirst, especially when I lie down, or maybe after eating, I do feel a lot of thirst in the throat, and sometimes I cannot even swallow the saliva. That is one. Number two, I have the cramps all over my ribs. The cramps, like ile ya wanawake yenye wakipika cramps, kama ile yenye wakati wao wa hedhi. Alafu sasa inakuja all over mpaka huku kwenye ribs zangu. Nimekuwa na chest pia imekuwa ikiniuma, kuna kitu kimefura hapa kwenye chest. And I have gone for hii picha ya scanning.
Yes.
Lakini haijatoa for it's like now 3 years now.
Wow. Okay.
What could be the problem, please?
Okay, Daktari.
Thank you so much.
Yes, sure. Okay.
You'll also
That's really complex.
Dr. Ashira
Sure.
will combine. Umeongea mambo ya beetroot. She talked about taking beetroot and then ends up with a bitter taste or something almost like pus in the mouth.
And dry.
And dryness. Ile kitu muhimu uachane na beetroot.
Please.
Alafu uone vile itakuwa. Saa zingine ni ile kitu tunatumia kwa mwili yetu ndio inafanya tupate hizo shida. Ukiona kitu na kuharibikia, hata kama ni kitu mzuri, wachana nayo. Ukisema mwili yako inakataa hiyo kitu. Alafu mwenzangu ataongea mambo ya cramps na hiyo chest swelling.
Yeah.
So two things. Hiyo gas unasema unasikia inaweza kuwa ni shida ya tumbo.
Yeah.
Inaweza kuwa ni reflux, acid ama shida ama indigestion.
Yeah.
Hiyo shida nasema ya ushungu ya kifua ni inaweza kuwa ni infection ya kifua ama kuna allergies ama kuna vile anasema kuna kitu anasikia imeswell inafura, inaweza kuwa ni growth pia iko hapo.
Okay.
So ile muhimu ni kama kwa Mombasa kuna hospitali nzuri huko Mombasa.
Yes.
Apitie tu kwa daktari mmoja amwangalie kila kitu.
Yeah.
Angalie tumbo na angalie kifua na angalie iko kama kuna shida yoyote.
Yes.
Yeah.
Just for your questions on 22232, even when you call us, we're talking about the ear, nose and throat. We're talking about tonsillitis. We're talking about sinuses. We're talking about adenoids in children. Even as we proceed, one is asking right here, very educative show, thank you very much. Ask the doctor if it's usually true. It's alleged that tonsillitis can cause infertility in men. Watershed period, but can we just mention this if it's any relation?
No, normally tonsillitis doesn't cause infertility in men. But he can talk a bit about measles, because a disease which can cause swelling of the what they call parotid glands, which is also near the tonsil area, but it's actually glands, salivary glands on the neck. He'll talk about it. That can cause infertility.
Okay.
But normally tonsils don't.
Okay.
Yeah, but he can mention.
Yeah, so infection around the nose, throat, ears can spread to the brain and cause some problem up there. That's the commonest place.
Yes.
But few specific infections like like mumps, they can actually go all the way to affect the testes, the testicles,
Okay.
and that can have long-term effect. So if somebody has got a mumps or swelling around the ear, the salivary gland near the ear, then they should get proper treatment.
Okay. Yeah. Absolutely. As we wrap up, kindly continue sending in your questions. A very few minutes to go ahead and answer all these questions. Can we talk about what we need to constantly have in our house to gargle and just make sure that we keep this area good so that we don't have the infections and the bacteria?
Let me start with what you should not have.
What should we not have in our house?
No, one thing is that among the myths is that most people think that when they have every sore throat, every nose blockage needs antibiotics. That is not true.
Okay.
So if anybody has got a sore throat or some running nose or a cough, then it's not all the time when they need antibiotics, and they should not rush into getting antibiotics. Then, so that is what one should be careful with. Otherwise, people should know themselves. People with allergies, then they should know what helps them. If there are people who get nose blockage and the drops or sprays help them, then they should have that. If there are people who have got allergies affecting the nose and the chest and they use inhalers, then they should have the inhalers. If there are people who get the bad breath or something else and they think they need some mouthwash, then they can they can use it as needed. So it is one should not have really a cabinet of medicines for the nose and throat. What one should do is eliminate the causes of the allergies if they have allergies. If it is a viral infection, just boost up the immunity. Eat well, live well, boost up your immunity, and then that will fight the viruses. Majority of the viral infections don't need any treatment. That is why whatever you use, whether you use aloe vera, beetroot, garlic, whatever you use, you'll think it has worked, but it has actually not worked. Your body was fighting off the viral infection.
Dr. Gikonyo, as I pick up this call, could you respond to this one who is saying kuoga, nikienda kuoga kwa bathroom, huwa na nosebleed, shida ni gani? Let's pick Mary first and then you'll respond to that. Mary in Mombasa, hujambo?
Hujambo, habari yako dada?
Sina neno mimi. Uliza swali lako.
Nilikuwa nauliza hivi. Mimi niko na shida kila wakati tu, hata mimi nafanya kazi. But hata nisipoenda kazi kila wakati nakaa kuchoka tu 24/7, nimechoka. Hiyo sasa inakuwa nayo ni shida gani kweli?
Okay, sawa. Tutakujibu hilo swali.
Nzuri, wachana nayo. Ukisema
mwili Asante sana kwa hiyo. Wow. Okay, I was going live on Facebook just to see who's watching. Just emphasis, we are talking about tonsils. We're talking about sinusitis. We're talking about adenoids. But we can respond to Mary. Mary is just feeling tired 24/7. What's happening with Mary?
Anasema anafanya kazi. Kuchoka, fatigue can be caused by many things. Could just be overworking.
Okay.
Could be maybe she's not getting enough sleep. Could be maybe she's not eating well. She's not getting good health, foods. Maybe she's not getting enough fluids. So she needs to look at the normal things.
Okay.
Maybe, but if it is a disease, then one needs to check what else is happening with her. Is she having trouble with breathing? Is she having trouble with the heartbeat? Is she having trouble with the swelling of the legs, swelling of the heart? Could be a heart problem. Could be a lung problem. Could be a kidney problem. Could be other diseases.
She needs to see a doctor.
Just get a checkup.
Yeah, so they can check your history and be able to have that conversation. Our brother here is going to the bathroom. Every time they get into that shower, starts nose bleeding.
Yeah, there are people who nosebleed, and sometimes it's early in the morning, like when there's a temperature change, like they come from bed, they go to the bathroom, they take cold water against their face, and they can end up nose bleeding. Now, the nose has a lot of blood supply. For the reason for this is that it needs to heat the air. As you breathe in the air, the nose heats the air, and the nose also gives moisture to the air, adds water to the air that you breathe in. So for that to occur, the blood vessels have to be very near the surface. But for some people, those blood vessels are completely on the surface, and even a small, movement of, touching your nose or blowing your nose is enough to trigger, that kind of thing. But in such cases, he needs to go to hospital because it's not good to bleed every day. There's some simple medications we give. antihistamines, liquid paraffins, and we also examine and see. And those medications often work. In the event they don't work, even in the office, we can use something called silver nitrate, pencils, and we can actually paint those blood vessels and make them harder, and therefore stop the bleeding.
Okay.
So he can get assistance, and certainly a nosebleed can be a nuisance, and he needs to visit a doctor.
Absolutely. Don't suffer with any of these things. There are methods. I mean, medicine is growing each and every day. As we wrap this up, question probably, when we were flying and, just taking trips, pain in the ears due to that pressure, what can one do to avoid that? Like, it's pain you hear like you're going deaf.
Yeah, that happens not to everybody, to a few people.
Yeah.
And the reason for that is that they have a problem with what we call the eustachian tube. Normally, the ear requires the pressure outside the ear and inside the ear to be balanced. And the tube which balances that is a tube which runs from the back of the nose to the ears. It's called the eustachian tube. If the eustachian tube is blocked, then when the plane takes off or the plane is landing, then you'll end up with severe pain, because it means the pressure on the outside is too much for what is on the inside. So that can also be treated through some nasal sprays or through some simple procedures after examining, and therefore such a person should seek medical assistance, especially if they fly often.
Awesome. Awesome. Let's go to your closing remarks as we wrap this one up. I mean, it's been a really educative conversation. Maybe what you can advise families to do in this season and even after.
So, ear, nose, and throat infections are common, and the general thing is, prevent them by good nutrition, breastfeeding for the small babies, good nutrition for the bigger ones, and then identify allergies and those who have allergies, and then seek treatment early for any symptom that is bothering a child or even an adult.
Absolutely. Thank you so much. And for you, Dr. Gikonyo?
What I would tell our listeners is one simple thing. Your body is all you have to go through life. You have one body. Doctors have no spare parts. You don't have a spare part of your hand, of your eye, of your throat. Look after your body. The other thing is stop poisoning your body. Don't smoke, that's poisoning your body. Don't take too much alcohol, that is poisoning your body. And then generally let your body deal with issues. For example, don't keep on poking with viburities and toothpicks and keys into your ears. You're going to cause damage. Don't talk on the phone for hours on end. A conversation lasting 2 hours, you damage your hearing. So look after your body, and your body will look after you. But if you neglect your body, then you'll be in trouble. If your body is unwell, go seek medical advice, early intervention, because that way your body will take you through to your old age.
Dr. 2 very important questions have just come in. Let's just go through them because we have 2 more minutes. You guys are very chap. I like it. Does sinusitis disappear over time in kids? And another one is asking, the adenoids have been removed, but the child is still snoring.
Yeah, the soft tissues at the back of the nose, the back of the throat, they grow from the age of 0 going up, and then they start reducing from the age of 6 years. So it's possible that a child who was having some troublesome problem with the tonsils or the adenoids, they'll reduce as they get bigger. Yeah, so it's true that whatever they're calling sinusitis, the blockage will appear to be reducing as they go on.
Okay, Doctor, you removed adenoids from the child, and they're still snoring?
Yeah, adenoids can come back, and often come back, especially if they are done when the child is very small. And the reason for this is that generally we don't remove all the adenoids. We just trim them, we scrape them. So some children, if they're very allergic, they can actually grow back fairly quickly. So the first place is to check, have they grown back? If they have not grown back, there can also be other reasons for the snoring. It can be the soft palate is loose, it can be the uvula is enlarged, it can be their tonsils. So the child has to be looked at, because snoring means it's a struggle in breathing. And any struggle in breathing is not good for the child.
This child also, the uvula was also removed.
Yeah, maybe it could be the tonsils, or maybe there's some loose tissues there. So they'll have to be looked again, and even maybe a scan taken to establish what may still be wrong.
Absolutely. Just to emphasize in the words of our doctors in studio, health is your greatest wealth. You must take care of your body, take care of these organs. They are not replaceable. There are no spare parts. Are there spare eardrums?
No. But we can make one from another part of your body.
Oh, really?
Yeah, but it's always better to use what God gave you. It's the best by far. Yeah.
Okay. Thank you so much for that. Even as we wrap up, why are the questions coming in now? This is my last question. If I ask any other question, say no, Kerry. A child is scratching their whole body before they sleep, and this parent says, please answer, what is wrong with my child?
Scratching is a sign of allergies many times,
Okay.
but can also be a sign of other diseases.
Sawa.
So try and identify what is it that causes the scratching,
Yeah.
and you can work out that at home and then present that to a doctor.
Monitor your child one more time. Just see what works, what doesn't work for them. Thank you so much for watching Health Check. Remember, you need to share this episode across with all your friends. It's on YouTube. It's on Facebook Live. Let's get people informed. And even as we fight coronavirus, there are still so many other little menaces and viruses that we must keep talking about. Definitely, I'll see you tomorrow on Hope FM, where you listen and live 4 a.m. See, we go. I need to go catch some beauty sleep. Thank you so much for joining us. This has been Health Check on Hope TV, where you look and live. Tony Omondi is ready with Newswatch at exactly 9 in the p.m. So catch up with him right there. Until next time, thank you so much, Daktaris, for joining us. I wish you well. Na watu wakuja hospitali waone daktari.
Thank you.
Yeah, absolutely. God bless you.
Okay.